I think general practice nursing is the best kind of nursing there is. It encompasses everything from childhood right through to end-of-life care. So it's the continuity of care and the human element that we put into our nursing and general practice. At Ochre, we are proud to support our nurses to work at the top of their scope, to be impassioned to do the nursing that they most enjoy, whether that's wound care, childhood immunisations, diabetic education.
It's not like other positions where you're working in the hospital or in theatre where I was previously. A lot of my patients were asleep. It was, assisting the anaesthetist to manage an airway or, ensure the patient's safety while they were in the procedure. Here I get to meet grandma, I get to dress her skin tears, I get to see the daughter for ear syringing, and then I get to meet the grandchildren for their immunisation schedule.
Coming into Ochre was really quite easy. Everybody takes the time to actually orient you and not just throw you at the deep end.
With Ochre, we've got a fantastic structure. We have policies and procedures in place to make sure that the patients are receiving the best care that they can.
We have a fracture clinic, a walk-in clinic. We have the GP surgery side also. We've had our walk-in clinic open for about 3 months. We're seeing about 60 patients a day, all different ages. It's very fulfilling as a nurse. Every day you walk away and you feel like you've done a really good job because people are very happy with the service.
When 1 in 3 Australians have a chronic disease within their lifetime, it makes sense that chronic disease is our focus in general practice.
We have very established chronic disease management here at Grafton. We're all involved, plus the GPs are all involved. It's just part of our normal workflow. It's part of our culture here.
The treatment room here is my pride and joy. I wish my house was this clean.
I've got one of the best GPs. I've dealt with the nurses as well during immunization. Very professional, friendly, good to my kids. I'm happy here.
It was a nurse job today. I couldn't be happier. They don't push you. They give you all the time you need. And I think that's important. Ticks all boxes.
One of the original things that attracted me to the practice was the concept of a very large team, very skilled GPs, high quality nurses, great admin staff, and having all the services on one site. Really caring about patients, having really good chronic disease management, working with the nurses and seeing them as our partners, recognising their skill base. This place really is a can-do clinic.
We have nurses across the network that have been nurses, lead nurses and now practice managers, and we've also had admin staff that have gone on to complete their nurse training and now working in the clinics as nurses.
Ochre is also Australia-wide, which is fantastic. There's certainly room for movement to other practices.
I feel very blessed to work for Ochre as an organisation. I've been offered wonderful opportunities. You can always go to somebody if you ever need any advice or help. They're very good at empowering us. They're a little bit like a family to me, to be honest.
I think Ochre is a fabulous organisation to work for. We are very inclusive and all of the support and education that you would need for career advancement is there. We have a fabulous team of nurses and doctors, and in many practices, allied health providers. It's just a wonderful place to work.